Good morning. Myself, JV and Dr. S.V. Yadav, Assistant Professor, Department of Surgery, Faculty of Homeopathic Science, Jayoti Vidyapeeth, Women's University, Jaipur. Today my topic is Principle of Surgery. Unit structure is Introduction, Importance of Surgery in Homeopathy, Purpose of Surgery, Basic Necessities of Surgery, Surgical Procedure Suffixes, Aseptic Techniques, Incisions, Flap Design, Tissue Handling, Hemostasis, Collaborative Management Assessment, Physical Assessment, System Assessment, Laboratory Assessment. Then Introduction. What is surgery? The art or principle of treating injuries, deformities and other disorders by manual operation or instrumental appliances. Surgeon. The surgeon is one who makes people better chiefly by exercise of manual skill in performing invasive procedure. Principle of surgery. A medical procedure involving an incision with instruments performing or repair damage or arrest disease in a living body. Human tissue have genetically determined properties that makes their response to injury predictable. The principles of surgery are based on proven techniques that help to optimize the healing environment. Importance of surgery in homeopathy. The homeopathy is a science need to clear application on part of physician to decide about the best course of action required to restore the sick to health. Knowledge about surgical disorder is required to be grasped will show that the homeopathic physicians are able to first diagnose common surgical case, second use homeopathic treatment wherever possible, third organize pre or post operative homeopathic medicinal care or total partial responsibility, fourth organize a complete homeopathic care for restoring the susceptibility of the patient to normally. Purpose of surgery. First, diagnostic, second, curative, third, restoration, fourth, palliation surgery which makes the patient more comfortable, and fifth, cosmetic surgery which reconstruct the skin and underlying structure. Basic necessities of surgery. First, adequate visibility. Second, assistance. Adequate visibility is based on adequate access, mouth opening, surgical exposure retraction, adequate light, and last, surgical field free of excess blood and other fluids. Surgical process suffixes. Ectomy means excision or removal of, for example, appendectomy. Next, lysis means destruction of, example, electrolysis. Next, orophy means repair or suturing of, for example, herniorrhaphy. Next, oscopy means looking into, means endoscopy. Next, otomy means cutting or incision of, for example, tracheostomy. Next, plasty means repair or reconstruction, for example, mammoplasty. Aseptic techniques. Medical asepsis means is the attempt to keep patient, healthcare staff and objects free from infection agent, and surgical asepsis describe the effort aimed to preventing microbes from gaining access into surgical grade wounds. Aseptic techniques. Universal precautions are applied to prevent sepsis and effort fall under the following headings. Number 1, instrumental sterilization. Second, operative disinfection. Third, surgical staff preparation. Hand and arm preparation, clean technique, sterile technique. Incision. Incision are necessary for many procedures that following principle applied. Use a sharp blade of proper size. Use film continuous stroke. Avoid cutting vital structure. Incision perpendicular to the epithelial surface. Intraoral incision should be properly placed. Flap design. Principle of flap designs help to prevent flap necrosis, flap disease, flap tearing. Tissue handling. Apart from careful flap design and incision technique, the careful handling of tissue is also necessary for optimal and uncomplicated healing. Excessive crushing, cooling, extreme of temperature, desiccation and harsh chemical damage tissue, and these should be avoided. Tooth forceps and skin hook are prepared to forceps the crush the wound edges. Avoid excess cooling force to retract tissue. Use copious irrigation with drilling or cutting bones. Protect soft tissue when drilling or cutting. Hemostasis. No effort should be spared to minimize blood loss. Wound hemostasis can be obtained by first assisted natural clotting process by applying pressure on a blood vessels or a hemostat. Second, use of thermal coagulation. Third, suture ligation. Fourth, pressure on the wound. Fifth, use of vasoconstrictors. Collaborative management assessment. History and data collection, age, drug and substance use, medical history including cardiac and pulmonary histories, previous surgery, blood donation, discharge planning.